Welcome to the Neonatal Intensive Care Unit at Abington Memorial Hospital. My name is Dr. Jerry Cleary. I'm an attending neonatologist and the medical director of our intensive care unit. Here at Abington, we deliver approximately 5,500 babies a year, many of whom are premature. Approximately 10% of babies born will require the services of a neonatologist and a neonatal intensive care unit. Here at Abington, we're a level 3 nursery. We take care of all ranges of gestational age and have capacity to do high-frequency ventilation and nitric oxide. Today, we'd like to introduce you to the environment that your baby will be in potentially for the next few months. Families who have babies in the NICU often are very intimidated by the environment. There can be a lot of noise, extra wires and tubes and machines that are connected to your baby to help them manage some of the problems of prematurity. There's a fundamental lack of understanding of complex medical conditions that can occur when your baby enters the NICU, and communication with your healthcare professional is very important. There's also the recognition that many families feel guilty and feel a loss of control when their babies come into the NICU. The environment can be intimidating, and hopefully we'll be able to alleviate some anxiety by introducing you to the environment today. Prematurity is a disease that can impact all of the major organ systems, and each major organ system needs to be tended to carefully. In addition to managing diseases like most other medical professionals, we have to do it while using systems in the body that are not meant to be used yet. So we have to be very careful about how we drive those systems in the lungs, in the heart, and the intestines to help your baby progress. In addition, we have to maintain an environment that is very supportive to your baby's developmental needs. Babies are in a rapid phase of development at this stage, and our environment has to match the needs for that development. So neonatal intensive care units look very different than adult intensive care units from that aspect. So what are we trying to accomplish when your baby comes to the NICU? Well, of course, the expected excellent bedside clinical care. We have to utilize very complicated technology to help your baby. We look to educate you and give you psychosocial support for your family, because this can be a crisis for the family to have a baby admitted to the NICU. In the end, what we aim to do is minimize the complications of prematurity for your baby. We want to provide normal growth for your baby who's born too small, and we want to provide an environment that promotes the normal development for your baby. And finally, the big goal is to transition them home safely to you for your family to continue on after the NICU stay. In order to accomplish that, one of the main things we have to take into consideration is the environment that your baby and you will be exposed to for the next several months. Babies spend most of their time in sleep, and there are different types of sleep. REM sleep is a sleep that we all undertake that is a very restful phase for us. However, for a baby, especially a premature baby, that's a very active phase of development. The brain is actively creating new cell-to-cell connections. And it's also telling the brain cells where to move in the brain. They go to where they should be. And we have to develop the environment so that we allow that brain development to occur as naturally and normally as possible. Your baby's senses develop one at a time. The first sense is tactile or touch. Your baby can feel touch early on in gestation. The second is their sense of position. We call that vestibular. But they can begin to get an understanding of their position. The next is taste and smell. Then auditory. Language development for your baby begins in the third trimester, around the 31st week of life. And then finally visual, which is the last to develop. Now, babies in utero naturally would be in a dark environment, so the visual system doesn't need external stimuli to develop. That's why babies who are born very early are maintained in dark, quiet environments. So what do we do in the nursery to help your baby stay in that critical REM sleep? Well, the first thing is we want to limit any noxious stimuli to your baby. As caregivers, we try to cycle our care. We all see your baby at the same time, so that the baby can have long stretches of undisturbed sleep and hopefully REM sleep for brain development. We minimize painful stimuli as best we can, although your baby will require some painful procedures like needle sticks. And we manage pain carefully. We continually assess babies for any evidence of pain, and we would treat it if they have evidence that they're in pain. We maintain a quiet environment. We try to use low voices and try to limit the acute loud noises. Alarms, doors on isolettes, things that would be innocuous to you and I can actually be quite loud and disturbing to a premature baby. We use isolette covers to maintain a dark environment. We also use eye protection if we're going to be turning the lights on for a baby so that they're not shocked by a bright light in the eye suddenly. When babies are born prematurely, they have a great deal of difficulty maintaining their body temperature. Maintaining body temperature is critical. And to do that, we use what are called isolettes or warmer beds. Isolettes are also known as incubators. Incubators are designed to provide several critical factors to the environment for the baby. The main one is thermoregulation, or heat transfer. If babies are too cold, they use a lot of energy in order to try and stay warm. And if they're too hot, they use a lot of energy in order to try to cool down. We maintain the babies in what's called a neutral thermal environment. That is a very narrow range of temperature so that the babies can utilize the calories that we give them. If we don't maintain that neutral thermal environment, then the babies can be stressed, and that can impact many of the organ systems in the baby. Incubators or isolettes also maintain humidity for babies. Premature babies can lose a tremendous amount of fluid through their skin because their skin is very thin. The humidity helps maintain fluid balance in babies. Certain isolettes are also designed to administer extra oxygen to the baby, and certain isolettes can monitor more than one temperature on a baby. They can monitor what we call a central temperature and a peripheral temperature. This is called thermal monitoring.